People talk about topical steroid withdrawal like it affects everyone, but topical steroid withdrawal affects so few patients, relatively speaking. I completely agree with this statement. I've never seen it in clinical practice. I've been a doctor for 10 years. I was at med school for 6 years before that. We use steroids quite regularly. I've used steroids topically myself because I've had eczema my whole life. Now, we do have ways of trying to prevent topical steroid withdrawal. Essentially, we try not to have people using steroids indefinitely. When I prescribe it, I always give the advice that it should be for 1 to 2 weeks max. If your symptoms resolve after a week, then stop using the steroid. Don't go to it as your first thing straight away whenever you have any kind of dry, rough patches appearing on your body. There are alternatives to topical steroids. For example, things like topical calcineurin inhibitors, but not many clinicians will have used them, so they may be reluctant to prescribe them. But ultimately, typically, a short course of topical steroids can usually break the cycle of the itch-scratch cycle associated with eczema or dermatitis and may just get you over that initial hump, and then you can use the emollients as needed to treat the rest of the symptoms.